Ladies and gentlemen, hold on. Ladies and gentlemen, here she is, Patricia Rocco.
Hello everybody, my name is Patricia Rocco. I'm from Brazil. I'm a physical therapist. Today is your number 24 day, and I'd like to say that you have to do it with all the power that you have and have a lot of courage. You can do this. Let's do it.
Day 24, people, let's do it. All right, that's good, thank you. All right, it is time for the question of the day, and today's question of the day comes to us from Hazel. And the question is, I'm wondering about exacerbations and how one would know they were heading into one or actually experiencing one. Is there a way to tell the difference between exacerbation and a bad cold, or exacerbation and the flu? Great question. Here are some answers. When I have one, my lungs close up and I can't breathe. Next answer, lungs get tight, wheezing, mucus, SOB with any exertion, even when sitting, coughing. Next answer, a cold could always lead to a bad exacerbation, so if any of the things mentioned above are happening, see a doctor. An exacerbation is when normal conditions of your disease change or get worse. All right, so let's talk about that. So good questions, good answers, okay? And you asked, is there a way to know when you're heading into an exacerbation? One of the things that I advise people to do all the time is to keep a journal, okay? A health journal. And the reason why I say this is based upon another idea that I say all the time, which is that information is really only useful, or certainly much more valuable, when taken over time as part of a trend. So in other words, one individual factor on its own can tell us something. Of course, if your blood pressure is 200 over 100, that's substantial. But it would be much better if we had the blood pressure before that 200 and the blood pressure after that 200, so that we could be able to say, okay, well, we have a situation, but what direction is the situation heading in? Even though they're typically used for asthma, I don't dislike the use of a peak flow meter for people with COPD. I don't dislike inspiratory muscle trainers for people, things like incentive spirometry, okay? Only for this reason, but to get a quick check of what's going on. Okay, so if you are typically able to take a breath in of 400 milliliters and then for 2 days it's 350 and then it's 300, you can tell that you're trending in the wrong direction. Likewise, if your peak flow is diminishing over the course of a couple of days, you can tell that you're heading in the wrong direction. And I want to just point out a couple of things. So crucial factors when it comes to anybody with a respiratory disease, and I would really include anybody with a cardiovascular disease in this. I would include anyone who's got any risk factors of frailty or immune issues, okay? It almost does not matter whether you have pneumonia, aka an infection, whether you have a common cold, or whether you have an exacerbation, okay? So the idea behind this is that the key factors are that you jump on it early, okay? Because think about this. An infection is going to be treated with antibiotics and maybe steroids. An exacerbation is going to be treated with steroids and maybe antibiotics. The flu may or may not be treated at all, and the common cold may or may not be treated at all, okay? But in the case of people with respiratory disease, there are things that come up where we don't just want this cold to run its course. We don't just want the flu to run its course. We don't just want this exacerbation to run its course, because as I say over and over again, when something is left to its own devices, bad things usually happen when it comes to our health. So what I mean by that is that if you do nothing about these things, then yes, you will probably suffer a more severe illness or injury to your system, and it will probably take longer to get rid of it, and the long-term effects could be more severe and have a greater impact. But keep in mind the fact that so often somebody gets sick. It's not only the illness itself that causes problems for the person, but it's the hospitalization, okay? It's the bed rest, it's the inactivity, it's the loss of nutrition, it's the added stress. All of these things will contribute to making your condition worse, to increasing its intensity, to prolonging the time that it takes for you to be free of this condition. And then unfortunately what happens a lot of times is that people get the idea that this is now their new permanent position in life, and you've taken the antibiotics so your infection is gone. Yeah, you've taken the steroids so your inflammation may be better, but you have not yet done anything to rectify the deleterious effects of bed rest and of lifestyle. So if you've been exercising daily and eating well and stress managing through meditation, and now you've gotten sick and you're not doing those things anymore, then that can have as great an impact on you as the infection or the exacerbation or the cold or the flu itself, okay? So keep those things in mind. Other things to keep in mind, okay? Take your temperature once a day. Get to know your normal, okay? Check your mucus. If your mucus either increases in amount, increases in thickness, changes color from clear or white to yellow, green, etc., etc., less energy, muscle aches or soreness, all of these things can point you in the direction and get you thinking that you are coming into some type of illness or insult to your body. Again, whether it be an exacerbation, an infection, cold, or flu, it matters, okay? It does matter, okay? The treatment is going to be different depending upon what it is, but key and most important, early treatment. Don't sleep on this, okay? Because a cold or a flu or an infection or an exacerbation for somebody with respiratory disease is very, very different, and the stakes are much higher than for somebody who has a normal immune system and who is not respiratory or cardiovascular compromised. So get thee to the doctor quickly, okay? Get treatment quickly. Don't wait on it. Don't wait to see if it gets better, okay? It probably won't on its own, or it will probably get worse before it gets better. So get the treatment, get back on the horse, try to maintain as many of the lifestyle factors as you can in terms of ultimate pulmonary wellness, exercising as much as you can, and sometimes it may not be able to exercise at all. It may not be possible to exercise at all, okay? Good nutrition will always help you get better, and certainly the breathing exercises, the stress management, the meditation, all that stuff is always going to be helpful, okay? So again, one more time, key points. If you don't feel well, if something's wrong, contact your physician, contact your nurse. Don't take a chance on it. Don't wait till you're deep, deep, deep in the hole. Don't sleep on it. Early treatment, okay? And again, keeping a journal is very, very helpful in terms of tracking trends, all right? Have a great day, everybody. Bye-bye. And just one other thing that I forgot to mention before that I should have mentioned, get the flu shot, get the pneumovax, read the chapter in Ultimate Pulmonary Wellness about prevention of infection. Prevention. An ounce of prevention is worth a pound of cure. That's true. That's true. Have a great day, everybody.